I was honored in 2005 with the Satava Award because people wanted to recognize that it's not just from the neck down, but it's from the neck up, that we need to think about the whole person. And so they wanted to honor the way that advanced simulations, advanced technologies were being used in the field of behavioral health care. I was originally treating patients with phobias, panic disorder, post-traumatic stress disorder from motor vehicle accidents using virtual reality computer simulations and therapy. And then the war broke out in Iraq and Afghanistan, and there was a grant put out by the Office of Naval Research saying, can you apply these same things for the military population? We were funded to design, develop, and test virtual reality environments for the military population. Post-traumatic stress disorder is a very serious anxiety disorder. It's brought about by a trauma, so a place where a person feels that their life is threatened. And so, of course, in Iraq and Afghanistan, people feared for their lives. And a lot of times what we tell people is it's a normal reaction to an abnormal situation. We actually have seen reference to post-traumatic stress disorder as far back as the Peloponnesian War in the 5th century BC. And so it's always been a part of war and of human life, human existence. It wasn't formally diagnosed as post-traumatic stress disorder till 1980. Virtual reality in behavioral health care has been used for the last 15 years by groups around the world. The gold standard for treatment is exposure therapy. Now, prior to virtual reality, prior to computer simulations and innovations, we either had the person sit and imagine what they were afraid of or what their trauma was. So imagine you're back in Iraq, imagine you're back in Afghanistan, imagine you're in a motor vehicle accident. With innovations, we've done a very good job with body armor, but we haven't done as good a job with mental armor. So we need to mentally prepare the patient for what they're going to face when they go into the battlefield. We call it stress inoculation training. We put the person into situations that they might be facing when they go into battle. We help them to understand and start to prepare themselves so that, for instance, if you're a combat medic, you want to be able to see that amputation before you go into the battlefield. You want to be able to mentally prepare yourself and focus on there's going to be bombs and bullets going off around you, but you need to focus on that patient, saving that patient's life, saving your own life.